Hey, it's Samuel from the floor at HIMSS 24 and with Danny Chang. He's the head of partnerships at Voyce. Danny, how's the conference been for you so far?
Oh, it's been amazing. The energy has been just incredible. There are so many people here, providers, we have, partners of ours. We have so many innovative, interesting things going on at the conference. We're very excited to be here again.
Yeah, it's awesome seeing so many people focused on healthcare IT, and you guys are focused in a pretty unique area, providing kind of on-demand, real-time interpretive services, and I know how important that can be to be able to speak the language of your patient. Tell me a little bit about that.
Absolutely. These are some of the toughest, most personal moments in patients' lives, and we get to help them have a voice. And we are doing it in over 240 languages, including ASL, number of dialects, and in about 20 seconds, you have an interpreter there who can make a patient feel heard, especially in a really challenging situation. We've already had people coming up to us, either talking about the work that we're doing at their hospital, their health system. We have a number of sort of integration partners as well who are saying that we're making it even easier to access an interpreter. And we're just showing a new thing to many people as well at the conference, looking for new innovative solutions. And it's been great to hear, and it's really validating to the work that we're doing. And so many of us are so passionate about language barriers and overcoming them. I'm the son of a Korean interpreter myself. My mom interpreted for 10 years, and many of us used to be interpreters. It's a really amazing sort of organization and mission to be a part of.
Because in healthcare, yes, getting the right diagnosis is important and getting to that, but there's so much about the nuance and the context and the culture from a specific patient's background and history.
Absolutely.
It really comes in, but you only get that in their native language.
Absolutely, yeah. The nuances of the culture, like you said, these things can immediately make a patient feel more comfortable, especially when they are extremely stressed about something that's going on with their health. And on the flip side, there's also the terminology when it comes to medical. A lot of times we have people who are bilingual, but they're not medical certified interpreters, and that's what we do. I mean, look, my Korean would fail our assessments immediately. I can tell you when dinner's ready, but I could not tell you about a cholecystectomy, right? And so our interpreters are going through 60 hours of training to ensure that they are able to interpret all of the complex terminology so that patients know exactly what they're experiencing when it comes to their care.
And I know that a provider always would prefer to have an accurate interpreter, but a lot of times they can default to a child or a bilingual loved one that's with their family member in the hospital. But you're right, like that medical context to understand, hey, maybe the doctor does really need to hear about this and should ask more questions to dive a little deeper. That does come from that certification and knowledge as well.
Yeah, and to that example, the first time a child hears their parent is sick shouldn't be interpreting for them. And so we give that dignity to the conversation on your own terms. And look, when it comes to the complex medical terminology, and we've heard so many times of, hey, there's a staff member who happens to speak Spanish.
Right.
And for us, we want to make sure you have the best quality of care in the language that you receive that care. And so for us, again, we can ensure that you are compliant when it comes to all healthcare regulations and ensuring that you are providing accurate interpretation, and there's no room for misinterpretation with us.
Yeah, and I've worked in a system where we had medical interpreters that were on site, or you could find a remote interpreter, but it was always hard. It took a long time, so patient care would be delayed because the doctor would go do their consult and visit, but they needed an interpreter, and that always took a lot of time. Sounds like you're speeding that up.
Oh, absolutely, yeah. I mean, our average wait time's about 20 seconds, and so, imagine, whereas before, you'd have to wait for, it might be an interpreter to come drive over halfway across town. You got at least an hour of their time that you as the provider or the administrator, like you have to be paying for that time. For us, it's you pay for the minutes that you're interpreting. That's it. There's no other fees. It's simple. It's on demand. And so this is such an easy solution. And again, our bread and butter really is that video experience. You see a smiling face. We do audio as well, but you're able to kind of assess the situation. The interpreter is able to see what's going on, say in the emergency room. They see what's happening. They can ease the patient's concerns. And it's also, you don't have to go through that explanation. It's someone right there almost instantly. They're not left waiting. And so again, it's really about improving that quality of care, that experience for the patient. And we're really, really proud of the work that we've been doing.
Yeah. That's phenomenal. It's really great, especially as hospitals and care providers are kind of pushing out into underserved communities. And this is just another tool to help make that process a little bit better. So, Danny, thank you for being here with us. And
thanks for
that's all for now.